sensual breathwork, Ting呼吸. If you do not have a mental image of the inside of your sinuses or the shape of the inside of your body, I would encourage you to look at one of those images the first time you do this. There should be one on the web page where you found this recording. Step 1, feel into the 10 locations. For this part of the practice, just spend 1 minute feeling into and listening with your mind and body into these specific locations and the interaction that your breath has with that part of your body, just as sensation. One, the inside of the bridge of your nose. As you inhale and exhale, very slowly and evenly, keep your attention on the inside of your nose, right between and below your eyes. You want to feel into the nostrils and the tissue and membrane of your nostrils, right behind the bridge of your nose. Location 2, the front of your sinus cavity. Just between and behind your eyes, inside your sinus cavity, is a little shelf. As you inhale and your breath passes your nostrils and enters your sinus cavity, it actually spins in a kind of vortex way around that little shelf. So as you inhale and exhale, notice the sensation of your breath as it passes this area. Sometimes opening your nostrils, moving your nose around, and with your imagination just opening up this space inside your sinus cavities can also help feel into this location. Just inhale and exhale, keeping your attention on this space and the sensations at the front of your sinus cavity. Location 3. The upper center of your sinus cavity. Right behind the center of your forehead, a few inches behind what people describe as your third eye, and right below the bai hui point at the top of your head is the inside central upper location of your sinus cavity. And again, this is why having a picture can be helpful at first. Bring your awareness to that location. As you breathe in and out, just feel your breath passing the membranes and the nerves inside the very top and center of your sinus cavity. Location 4, the back of your sinus cavity. If you feel into your sinuses near the back of your throat, where mucus tends to build up if you ever have the sniffles, that's the place you want to keep your attention. As you explore the back of your sinuses and the top of your throat, notice that your breath suddenly has to change shape as it goes from the large space of your sinuses down into the top of your trachea and lungs. As you inhale, feel into the shape of your breath as it begins to tunnel down your throat, spiraling like water down a drain. As you exhale, notice how your breath expands and fills the space of your sinuses. Just inhale and exhale, keeping your attention on the location of the back of your sinuses at the top of your throat. Location 5, the bottom of your throat. Swallow some saliva and feel that place in your throat where the saliva is finished being squeezed down your throat and begins to fall freely into your stomach. Keep your attention there, breathing deeply and slowly. Sometimes it helps to hold your mouth open for a moment to ensure that you can feel your breath passing the back of your throat. Also, sighing quietly a few times can help your attention find this location. As you breathe in and out, allow this part of your throat to relax and open, gently feeling into the stretch of the membranes. This may make you salivate more, so now you have another opportunity to swallow and to come back to your present sensual experience at the bottom of your throat. Location 6, the top or the lid of your chest. Take a deep breath and then sigh. It's almost an instinct when you take a deep breath to pick up the top of your chest and then to sit it back down. In fact, a lot of us use this gesture as a form of body language to let other people know that we're feeling impatient. Take a couple of deep breaths and exaggerate that experience. Inhale, lifting the lid or the top of your chest, your shoulder blades and collarbones. Exhale, and just slowly put the lid down and let it fall into place. And let the weight of the lid push your breath out as you exhale. As you explore this location, trust your intuition. If your body wants to experience more movement, more pressure, more up, more down, more emotion, or more subtly, then follow your intuition and feel into your body in that way. After a few moments, also give yourself permission to just be as quiet, calm, and still and attentive, so that as you inhale and exhale, all you feel is the lid of your chest moving with your breath. Location 7, the barrel of your chest. As you fill your rib cage with breath, you'll be stretching out a barrel-shaped and flexible container we all know and love as your rib cage. As you breathe into your rib cage with intention, you will be interacting with the deeper muscles and fascia that move with your chest and ribs as you breathe in and out. Take a minute and just breathe into the barrel of your chest. You may want to use a mild perineal floor contraction to help direct your breath into your ribs, front and back, side to side, up and down. Location 8, your entire abdomen. Take a few breaths and just focus on your belly, your flanks or sides, and your lower back. As you inhale and exhale, keep your attention on the stretching of your abdomen, sides and back, as well as your diaphragm and into your lower body. Location 9, your perineal floor. Take a few breaths, using enough effort to lift the lid of your chest, stretching the barrel of your chest, and stretching out your entire belly and abdomen. This is only possible if you can hold some tension in your perineal floor and use your whole core muscles to breathe in the directions that you choose to stretch out your chest and belly and body. As you inhale and exhale, keeping your attention on your lid, your barrel, and your belly, also keep your attention on your perineal floor. Allow all of those membranes to have a conversation with each other and to find a mutual kind of tension and relaxation. And you will know that you have found that mutual connection when you can feel your perineal floor holding some tone, but also releasing gradually as you inhale, and contracting almost on its own as you exhale. Location 10. Your Bai Hui and Hui Yin elastic. If you bring your attention to your Bai Hui point and your Hui Yin point and engage in deep and slow breathing, you may find a sense that Bai Hui and Hui Yin, the top of your head and the bottom of your perineal floor, are moving away from each other and then back together. This location in the breathwork practice is actually the feeling of an elastic that connects Bai Hui and Hui Yin. As you inhale and exhale, feel those two acupuncture points moving away from each other and together. And more importantly, become the elastic between the top of your head and the bottom of your perineal floor,